Hello and welcome. I see that we have people joining. My name is Marian. Thank you for joining the GDHN July webinar. I'm just going to wait a couple minutes as we see more folks joining, and then we will pass it off to begin the session. All right, it seems to be slowing down a little bit. As I said before, my name is Marian. This is the GDHN July webinar. Welcome, thank you. And with that, I'll be passing it off to Dr. Alvin to begin the session.
Thank you, Marian, and thank you to the Global Digital Health Network. On behalf of my boss, Dr. Bunchay Kitsanayotin, who's over there, I'd like to start the session. We have quite a number of presenters, so we requested them to do a pre-recording so that we can do a smooth transition between country presentations. But we will have a live Q&A later with them. Thank you very much. I see Pabimo in the audience already. So today, we are talking about the Asia eHealth Information Network Community of Interoperability Labs. This is our network's approach to data sharing and as a preparation for the next pandemic. Knock on wood that we will not have one in our lifetime. Next slide, please. So we are AeHIN. We are an informal peer learning network created by the World Health Organization way back in 2012 to help ourselves with our digital health development. AeHIN was formed on the principle that people are at the core of interoperability, not technology. And AeHIN creates opportunities for our own governments and our own civil societies to collaborate behind their national digital health strategy. Our picture here is in our last general meeting, graciously hosted by the Ministry of Health, Indonesia. Next slide, please. Next slide, please. Our problem statement is we are unable to achieve interoperability. That was our problem statement in 2011. And over the years, we have gone through various meetings, conferences, debates, and arguments on how we will solve this problem. It started in 2011 when we all first met in a meeting hosted by MOH Vietnam, WHO, and USAID. And then there were a series of events such as the launch of the WHO National eHealth Strategy Toolkit, a group of 26 AeHIN members undergoing certified training in HL7 version 2, and then going on to TOGAF certification training. Finally, by 2015, we were together in Manila, and we all agreed HL7 is not enough. TOGAF enterprise architecture is not enough. We need to have governance, and we need to have real people knowledgeable with interoperability, and therefore we should start building interoperability labs in each of our countries. By 2017, 6 countries have accepted the challenge, and in our general meeting in Colombo, all of them committed to start building up their interoperability laboratories. Next slide, please. And so 2018 was a very busy year with support from the Asian Development Bank and the World Health Organization. We started training ourselves. We attended various meetings at the sidelines of the Prince Mahidol Awards Conference to talk about digital health investment in Taiwan, hosted by the National Taipei University, successively on integrating the healthcare enterprise and FIRE with James Agnew and Jürgen Brandstatter in ADB Manila, and then in MOH Vietnam on the Health Enterprise Architecture Framework with Graham Grieve. And finally, when we launched in Colombo, we called it the Community of Interoperability Labs, or COIL. Next slide, please. So right now we have 10 countries with varying degrees of advancement in terms of their interoperability lab. We have New Zealand, Indonesia, Malaysia, Philippines, Sri Lanka, Taiwan, Thailand, Hong Kong, Laos, and Nepal. Next slide, please. Together, we call ourselves the Community of Interoperability Labs. These are our meetings. We've had a lot, and we're very excited in the next 5 years. The left upper is in Manila. On the right upper is UP Manila again. On the left is Naypyidaw. Oh, yeah, Naypyidaw, and 2018 was in Colombo. Next slide, please. So in 2022, Taiwan graciously hosted us, the Interoperability Lab in Taiwan, and we all agreed we should start sharing knowledge. Sharing knowledge on governance, sharing knowledge on architectures for interoperability. Next slide. Sharing knowledge on what we need in terms of capability building of people, on interoperability, HL7 Fire, on program management, and knowledge sharing on standards and interoperability. We all agreed as COIL that we should focus on the international patient summary. The standard is much, much larger than IPS, but we all agreed to start with IPS first. If we can't do IPS, then we can't do the rest of the standard. So we are focusing the next few years on IPS. Next slide, please. We had a meeting in Kuala Lumpur. In that meeting, we formalized and finalized the training that was offered by Standards and Interoperability Lab Thailand on FIRE. We had a lot of participants from AeHIN, AT. Some of them even got certified officially through the HL7 certification process. Next slide, please. And then we had the COIL came together physically at the general meeting hosted by the Ministry of Health and BPJS in Indonesia last year. And we had an interoperability demo, which I encourage you to watch. There's a link at the right lower corner. It's an interesting spin on interoperability. It's a story type way of sharing interoperability challenges. You should meet our Minister of Health in the interoperability demo. He is Dr. Bunchay. Next slide, please. And then we had the succession of events. We hosted MIT Critical Data in Manila last year, and then they transferred to Dr. Bunchay in Thailand, and then finally we had a meeting in Taiwan. And I will talk and return about what's going to happen in the next 3 years at the end of my talk. Next slide, please. And I
Yes,
think this is the start of the presentations. Go ahead, Chuck.
thank you, Dr. Alvin.
I'll be back.
Good day, everyone, and I am here to present the University of the Philippines, Manila Standards and Interoperability Lab, or UPMC Lab. I'm Dr. Miguel Aljibe, a project manager for the lab. UPMC Lab was established in 2022 and is under the National Institutes of Health of the University of the Philippines, Manila. Our lab is composed of members from many different backgrounds and sectors who all share the same vision of quality health for the underserved. Our lab director is Dr. Alvin Marcelo. Our other lab members are listed in this slide. Majority of our members have received training and certification from the Open Health Information Exchange Academy and the Digital Health Planning National Systems course conducted by TechChange. We share the expertise and knowledge that we have through our public webinars, as well as the training courses we have conducted for the Department of Health and the Philippine Health Insurance Corporation, as well as other stakeholders. We have also developed draft fire profile and implementation guide for viral hepatitis. We are fortunate to have received support from the Department of Foreign Affairs and Trade of the Australian government for our capacity building initiatives on digital health in the Philippines. For the next few months and years, our focus now is to build tools for development and testing with possible future reuse by the AeHIN community. We're also focused on establishing the Philippine community around interoperability. So that is all. So thank you so much and have a nice day.
Good evening, everyone. On behalf of Dr. Prapat Suriaful, I am honored to present to you an overview of the Standard and Interoperability Lab Thailand, or SEAL-TH, comprising highly passionate health and health IT professionals from both the Ministry of Health and the academic sector. Our members volunteer their time and expertise to tackle the critical issues of healthcare interoperability in Thailand. We focus on standards such as HL7 Fire and SNOMED CT to ensure seamless health data exchange across different platforms and institutions. Our dedicated team comprises professionals from diverse backgrounds, including physicians, nurses, and pharmacists, all working together to advance our mission. Each member brings unique expertise to our collaborative efforts, ensuring we cover all aspects of health data interoperability. Our journey began in 2019 about interoperability. By 2020, we launched our first pilot project in Kampang Pech to test the implementation of FHIR, and the results were promising. Following this success, we initiated a project to transform outpatient claim data into FHIR resources and implemented a blockchain-based personal health record system. This system enables patients to access their medical prescriptions through a web application. In 2021, we continued to innovate by mapping FHIR resources to medically participating in Thailand's National Reform Plan's Big Rock projects. Our efforts aim to significantly improve public health outcomes through these initiatives. The Big Rock projects also aim to prepare Thailand for emerging diseases and create a robust digital health infrastructure. Is in the Big Rock 1 project, focusing on emerging diseases such as COVID-19. We aim to enhance Thailand's preparedness and response capabilities through innovative digital health solutions. We also become a member of SNOMED International. Looking ahead, we are partnering with the National Health Security Office, NHSO, to drive national FHIR adoption. By simplifying hospitals with open source FHIR software, we aim to empower hospitals with seamless access to standardized health data, ultimately improving patient care and operational efficiency. And that is our journey with the Standard and Interoperability Lab Thailand. I must say, a big thank you goes to ChatGPT for the voice narration. Not only does ChatGPT have a better accent, but it also ensures that everything is clear and concise. If I were giving this narration myself, we'd be here for more than 3 minutes, and I'd probably stumble over a few words. So I hope ChatGPT made it easier for everyone to understand. Thank you all for your attention.
Morning, good afternoons, and good evenings, distinguished ladies and gentlemen. First of all, I would like to thank for GDXN and also for AeHIN, Dr. Bunchai and Dr. Alvin for having me today. Yeah, at this moment, I will share and also with my colleagues, Dr. Bimo, talking about our digital journey for health improvement, especially for digital health tech industry, and also how we implement the IPS for health. Yeah, in the first slide, I will share you our visions for health technology transformations. What our aim is how we can engage or pulling all the personal health medical records coming not only from the health facility, but also from the online consultation like telemedicine, and also including from the wearable devices. We hope we can input or we can ingest all the data into our national medical records from early beginning of life into our citizen is died. So with this data, we hope we can improve our health services, especially for personalized medicines and also acceptable from all the citizens in Indonesia. Now, after COVID, yeah, this is the big lesson from us, how we can improve not only the health information services, but also all services, for example, like primary care, referral system, transforming health financing, and also health workers transformations. The system itself is supporting from this transformation. We launched the blueprints on the end of December 2021. And then 6 months after this, we launched the platform. We call this Satu Sehat, Health Information Exchange. We built in the standards and also the terminologies like ICD-10, ICD-9, and also we developed the own medical reference, and also many things, yeah, to make sure all the legacy system can connect with us. Satu Sehat, not only we develop the platform, but also we transform the COVID app into the Satu Sehat mobile. So the citizen now can access their medical record using mobile. And then currently the Satu Sehat already downloaded more than 100. And then also we develop the dashboard Satu Sehat data, and then many things to make sure all the data can capture from any different services like hospital, primary care, etc. For the Satu Sehat itself, currently already connect with us 60% of our health facility. More than 38,000 already connect and already sent to our system. And then we hope with this initiative, the doctors can access the medical records coming from any different health facility. And also the people can access their medical records. We hope can exchange data not only from health facility, but we hope in the further forwards or in the futures can have also accessibility from others country. For example, what we're currently doing now with the Arab Saudi for Haji pilgrims.
Thank you, Pak Setiaji. So I will continue the presentation from this. IPS, as a International Patient Summary, is a standard data form of ISO. And we follow this kind of model that people from the home countries, their health data together with them. So Indonesia and Saudi Arabia is in the first phase, now having this model of health data exchange. The Hajj pilgrims will have their IPS QR code printed in their ID by the doctors, healthcare workers from KSA, or even from the Indonesia, doing the health check mobile there. So it is quite straightforward. The demo is like here. Okay, so just scan, enter the code, and we have the secure web viewer, and all this health data is shown for the healthcare worker help the patients. So currently, we have seen the use until the 18th of July, mostly from the non-whitelisted IP. It is the Indonesian mobile healthcare professionals in Saudi Arabia. The top 10 ICD code is like hypertension, hypercholesterolemia, senility, and also the hyperlipidemia. So thank you, and hopefully we can have more discussions on this matter.
Greetings from Standards and Interoperability Lab Sri Lanka. The lab was established under the Health Informatics Society of Sri Lanka, and we work very closely with the Ministry of Health, Sri Lanka, and the Sri Lanka College of Health Informatics. And the lab manager is Professor Vajra Disanayaka, and we have Dr. Palita Karnapema, Director Health Information, as an advisor. As you know, Directorate of Health Information is the focal point for digital health in Sri Lanka. And myself and Dr. Roshan Hewapatirana are team leads. And we have more than 10 active members, and most of them have availed to the training opportunities given by the AeHIN and other societies. So we are very grateful for that opportunity. Some of the past noteworthy activities we have done include development of fire implementation guides in support of the National Electronic Health Record Initiative, and we also supported creating wireframes for a patient portal for the National Electronic Health Record, and facilitated activities related to the connectedness. We conducted many knowledge sharing sessions with regard to OpenHI reference technologies. We partnered and coordinated with the technology providers to deliver these. and also one of our members, Dr. Rukshan, supported developing a smart on fire wrapper for the Happy Fire server that was piloted and initiated in the Ministry of Health implementation. And what are the future activities that we have planned? So I think the main activity we conduct is on capacity building. So we have capacity on fire training and IG developments, which we provide regularly. And also we are looking to identify and customize a free and open source international patient summary viewer that we could incorporate into the National Electronic Health Record. And basically, we work very closely with the Ministry of Health, as I said, and the Sri Lanka College of Health Informatics in furthering digital health standards and interoperability in the country. And one important aspect that we want to cover is the radiology workflows, because that has impact on reducing the cost and bringing value to the health system. So we are working on an open source radiology information system, which we hope could mature into a global public good. Thank you.
Hi everyone, I am Azrin and I am representing Malaysia to update on the standard and interoperability lab that we have established in our country. Our SIL in Malaysia were established as part of the Health Information Exchange Project, which was and currently being managed by the Planning Division of MOH. And there is also another lab which focus on the Hajj IPS. That was a special effort under the Digital Health Division. Our plan in future is to do a collaborative effort between public and private to act as independent body to manage the SIL. And the lead organization that will work closely with MOH will be the HL7 Malaysia that was newly established. And we hope to get everybody to come on board, either from the private sector or from the MOH, and also from other ministries in all the activities going to be undertaken by the lab. The advisor for our lab is Dr. Fazila. Currently, the team lead from MOH, Dr. Shafuza and Dr. Mahesh, while myself and Mr. Naveen are the representative from the private sectors. And in the SIL, we have many members came from different stakeholders. There are pharmacists, doctors, nurses, lab technologies, and many more. Together, we develop and publish Malaysia HL7 Fire Implementation Guide. So HL7 Fire has been chosen as the de facto standard to support interoperability. And the implementation guide itself is pretty much based on the use cases identified from 4 different segments in our health ecosystem. So we have a population health segment comprised of individual, families, and communities with different mobile applications that able to establish a personal health record for individuals. And that can be integrated to a system within a healthcare facilities, either clinics, hospitals, or different type of ancillary services such as lab, radiology, pharmacy, so on and so forth. And all the system need to comply to HL7 Fire, following the implementation guide and integrate via HIE so that we can aggregate the data into one single clinical data repository that able to produce a lifetime health record for every individual. And with the establishment of the repository, we are able to produce different type of report, dashboard, which is important for health intervention, as well as to work on the risk stratification, etc. And in future, we hope to be able to provide implementation guide where there can be integration between healthcare financing platform and healthcare facilities, as well as different types of personal health record mobile application. We managed to conduct our first HIE Connectathon event last year on the 15th and 16th November. So our future plan is to consolidate the interoperability lab into one single national SIL, and it is planned to be a collaborative effort between HL7 Malaysia Society that we newly formed together with Ministry of Health, and we hope that the establishment will act as an independent body that will bring together experts from across the country to lead the localization efforts of HL7 standards into our interoperability requirement. And we will pretty much focus on fire implementation as well as IPS. And the lab will continue to develop and maintain Malaysia Fire Implementation Guide and make it easily accessible by vendors and by different stakeholders. And we will continue to work on the Malaysia Connectathon event, and we hope to do it a bit more regular next year. And one of the focus that we have is to also work on Smart on Fire application ecosystem within the HIE platform. So with that, I end my updates on standard and interoperability lab for Malaysia. Thank you.
Good evening, everyone. The Aotearoa New Zealand Interoperability Lab, ANZIL, was established in 2022 and is sponsored by S23M Healthcare Solutions. Current members include Jon Bettin and Keith Duddy from S23M, Peter Jordan from HL7, who is the International Patient Summary Implementation Lead at Te Whatu Ora, which is also known as Health New Zealand, John Carter from HL7, Alistair Kenworthy, who is the Standards Lead at Te Whatu Ora, and Matthew Valentine, who is the Head of Clinical Informatics at Te Whatu Ora. Beyond promoting digital health data interoperability, the motivation for establishing ANZIL relates to unmet healthcare needs of remote and intersectionally marginalized communities. As Kerry Nuku from the New Zealand Nursing Organization notes, we've got to find a mechanism that we don't complicate access to services and diminish the quality of life just because of bureaucracy. We've got to make sure that we free up services to get to where they're needed. Here's an overview of ANZIL activities to date. We facilitate and support standardization activities within the ANZIL membership relating to the International Patient Summary, IPS version 2, and the HL7 NZ standardization of the New Zealand base profile. Reviewing Health New Zealand's API and security standards. And then also on an ongoing basis, we are capturing patterns as candidates for reuse within AeHIN. Work in progress includes preparing a fire profiling style guide and best practices. Additionally, we are contributing to the implementation of fire profiles. In this context, we have developed a repository for IPS resource exchange using fire formats and protocols, and we have documented related code tutorials with examples. We have also assisted with documentation of fire APIs within OpenMRS. An outline of planned and envisaged future ANZIL activities, assisting implementers of the International Patient Summary, version 2, reviewing of NZ Health Information Standards Organization Standards, so that's HISO standards, participating in the Australian Department of Foreign Affairs and Trade and Australia's National Science Agency, CSIRO Partnership for Strengthening Regional Health in the Asia-Pacific region, and adapting and reusing patterns of standardization within AeHIN countries. We are inviting local community representatives with lived experience, Maori health service providers, primary health organizations, Te Whatu Ora and other health IT solution implementers to join the lab. Thank you.
I would like to introduce the SILHK. SILHK is funded by eHealth Research Institute Limited. The institute belongs to the private sector. I am the CEO of the institute and also the lead of the lab. The institute uses its own resource and looks for public and private funding to support the work of the lab. The lab is now in the initial stage. The lab aims to provide the studies of how the interoperability of health data between the patients and the healthcare providers, as well as different systems and apps, and it uses the approach of decentralization and incentive with the support of AI, blockchain, and metaverse to study how they could better benefit the healthcare delivery. The study of the lab will focus on Hong Kong, but we also hope to collaborate with other countries and regions for different projects. Hong Kong eHealth kickstarts since 1990, and the development is led by the Hong Kong government. It makes the health reform in 2008, set up the eHealth office, and launched the eHealth program in 2009. It's as the blueprint of achieving territory-wide eHealth record sharing between the public and private sector. It passed the eHealth law in 2014 and launched the eHealth record sharing system in 2016. Our institute experts support the eHealth development since 2009. We are familiar with the sharing system, eHealth standards, AI, blockchain, metaverse. We hope the lab could do some studies and pilots as the practical ways to help to solve some healthcare delivery issues. Now we are looking at 3 healthcare delivery issues. First, the incentive for private sector to provide their patient data to others, and also the incentive between the sharing of health data of the different systems and apps are not enough. Although we already have a sharing system. Second, the healthcare providers and patients are difficult to operate the data shared by the private sector. Third, the results of the first and second issues, the patients are not easy to manage their health once they are out of the clinic, hospital, and health center. It's still far from the seamless, patient-centered, and collaborative healthcare delivery. To further look into the above issues, our lab is now working with different partners to formulate some research and pilot projects. One of the possible projects will be in the area of the primary health care and chronic disease management for the elderly. SILHK, as a member of the AeHIN COIL family, we are glad to share our know-how and knowledge to AeHIN friends and partners. We also welcome for any collaboration and support. Thank you very much.
Good evening to all. My name is Ted from Laos. Today I will present to you a little bit about our laboratory. We have done a little bit about our laboratory, just finished to develop the concept notes, but not yet approved from the minister. The next step we will request to the leader of the MOS to get approved and support our laboratory. For the recruiting of the member, I have discussed with the mini sector like within MOH and without MOS, such as the National University of Laos, Faculty of Computer Science, Faculty of Informatics and Technology. And we have the good cooperations with the Ministry of Technology and Communications, and we'll ask them to support about the infrastructure. For the consultants, periodically we work with their developing partner like ADB, WHO, or SHI, so that we'll recruit them and ask them as their consultants. For the next activity, we will focus about the hospital information system or health insurance and standard interoperability, and conduct the research on digital health and develop the policy and regulations to ensure the data security and privacy, and also the set up infrastructure. We just start, so that we need all of you to support, especially to building capacity, because right now we don't currently we don't have any leader in the country, because I still study in Japan, and my team, 2 people also study in Thailand, that we have scholarship support from the Peer Foundation. So I think that's all for me. If you have any questions, please let me know. Thank you.
Good evening, Namaste. I am Ramesh Raj Subedi, and I am working as an IT director in the Ministry of Health and Population, Nepal. We have recently established the standards and interoperability lab in the ministry. As a member country of AeHIN, we have followed the standards and guidelines to establish the lab in our ministry. Globally, the field of health information technology is growing rapidly, and both the government and private sectors are developing a large number of health information systems. However, a major issue is on lack of interoperability due to the complexity of healthcare systems and the absence of information standards. In this regard, a health interoperability lab that we have set up is an initiative from the ministry focusing on the interoperability of digital health applications. It is a collaborative space equipped with digital health experts to facilitate the design, development, and testing of various healthcare systems based on the globally recognized standards, which are interoperable with other information systems. COIL Nepal provides technical support to stakeholders to make healthcare systems interoperable through foundational digital health frameworks, standards, and emerging technologies like IRC, FSIR, blockchain, and etc. For this, we bring together the highly passionate experts from government, non-government, academic, and private sectors to establish and promote standards and frameworks that enable interoperability among diverse healthcare systems, devices, and data sources. We offer a platform for both public and private sectors to replicate healthcare systems and applications, laying the foundation for assessing data exchange quality and system interaction prior to deployment in real-world scenarios. The Standard and Interoperability Lab envisions a digital health ecosystem where healthcare systems and applications seamlessly exchange information, enhance efficiency, improve outcomes, and ultimately transform the delivery of health services. Through cutting-edge digital health applications, we strive to facilitate seamless exchange and dissemination of health data, ensuring interconnected systems that empower informed decision-making and holistic healthcare delivery. The mission of COIL Nepal is to provide technical and capacity building support to the related stakeholders in making the health systems follow standards and interoperability by fostering communication and collaboration. SEAL functions as four key services as AeHIN guidelines, that is teaming, tooling, training, testing, and transformation. The governance structure of SEAL embraces a collaborative approach involving multiple stakeholders to ensure effective management and decision making. While the specific structure will be developed later, an initial proposed framework consists of a technical working committee chaired by the division head of quality control and regulation division of the ministry, and the committee member includes the member from Ministry of Communication and IT, National Planning Commission as well, and from the departments and divisions of the ministry. Additionally, there will be several other committees such as the Developers Committee, Standards Committee, Testing and Certification Committee, Quality Assurance Committee, and the User Committee. The several committees comprise the experts and professionals with specific domain knowledge in areas such as interoperability, standards development, data exchange, and technology implementation. They work on dedicated projects, research and development initiatives to advance interoperability and provide technical insights to the lab. Thank you.
So I'm Xuan Li, and so about the standard interoperability lab Taiwan, we start from the 2015 and we're working with the AeHIN for a very long time. So our COIL Taiwan's goal is focus on the SGDS and is focus on the goal 3, good health and well-being. So we focus on the patient-centric precision healthcare in the is a critical and required personalized data. And we also want to prove in the effective analysis and disease prevention to achieve all aspects of healthcare. So in the Taiwan side, we trust the integrate all of the personal information for precision medicine and healthcare will be contributed to reach personal health management and good health and well-being of the patients. So right now in the COIL Taiwan team, our manager is Professor Jianye Xu, and he also is IASH fellow, and I am team leader Xuan Li. And right now under the COIL Taiwan team, we have 9 people as a team member, and everybody had a different skill. Someone focus on the fire, and someone focus on the data analysis, and someone focus on the programming. And also we working in close collaboration with the Ministry of Health and Welfare in Taiwan and the Taiwan Association for Medical Informatics. And also Taiwan right now hosting the APAMI. So also we had more international connection under the right now association. So start from 2017, every year we were hosting the Taiwan AeHIN international collaboration workshop, and till last year we also hosting the international workshop in Taiwan. So every year we will have a different activity and invite more people to come into Taiwan. So hope in the future more people can come to Taiwan and we can working together. And this year we will host in Asia Pacific Fire Interoperability Connect Zone in Taiwan, and based on the IPS format, we're doing a very simple exchange situation to try to have an international data exchange scenario and really adoption and really implement it by the system to doing that. So the time is in the September 2 to 5, and we also encourage people come to Taiwan together. Yes, this is my presentation.
Thank you very much to all the presentations. As you can see, they are very, very excited to have their labs, and they're doing their own pet projects within their country. And we want to tap onto that community of knowledge that is happening already in the different countries. So that will be our next steps. As you can see, if we did not do the recording, we will be losing time transitioning from one speaker to the next. So I like to express my gratitude to all the speakers for sending the recording ahead of time. Can we have the next slide, please? So what's going to happen? This lab, remember, this presentation was not existent 2 years ago. We just had, like discussion about we need interoperability lab now. The labs are emerging. They're getting together. They're getting their resources. They're getting trained. So now we need to support each other. We need to share the expertise. We need to share resources, knowledge, and skills. We want to pool. If there are source code that can be reused, let us reuse them. Let's just share them across all of the community. Let's meet whenever we can. It can be formal, like we got an invitation from Interoperability Lab Taiwan to send 6 people over there. We will have a connectathon hosted by DTO in Indonesia. There will be another one in Manila. So where it is possible, let's invite each other. Strengthen the link of your lab with your MOH. If your MOH does not yet recognize you, please let us know. Together as a community, we can approach your MOH and tell them, congratulations, you have an interoperability laboratory in your country. I hope that together with our own MOH, you and your lab can meet with our own MOH and our lab in Prince Mahidol Awards Conference next year in Bangkok. So these are things we can do as a community. We're not working alone anymore. We are working as a swarm. We are working as a hive. And by doing so, we become more powerful and we can do more things than we can if we do it alone. We share connectathon methodologies. I hope that we will learn a lot in Taipei and then bring that and do a better one in Jakarta. And then bring that, learn from it, and do a better one in Manila, so forth and so on. Any source code that can be reused, let us reuse them. Best practices should be disseminated as soon as possible. The lessons, especially if they are painful, the more painful, the better. The better to share so that it will not be repeated anymore by the other labs. So some of the important dates are on the screen. Next slide, please. This is a graphical representation of what I think is going to happen in the future. AeHIN COIL is just one of the regional COIL. And then there are IOLs or interoperability labs in each of those countries. And they have to deal with their own problems. They have to face their own stakeholders. Pabimo will have to talk to all the health tech companies and hospitals in Java, in Jakarta. And that's a lot of work already. But at the same time, whatever they're doing in DTO Indonesia is standards-based. So we can learn from what Pabimo learns as they engage with their local stakeholders and bring that back into the community of interoperability labs so that Manila, Indonesia, Manila, Thailand, Malaysia, Nepal, Laos can learn from that experience. And then hopefully this regional COIL will converge and become the global COIL. And I appreciate the offer of the Global Digital Health Network to host this regional COIL conference. Next slide, please. And I'd like to end with this statement before we open the floor to our participants. I'd like to quote our chair. He has a different word for it. Like, people is at the heart of interoperability. It is not really technology. And I will ask Dr. Bunchay to use his exact words. Dr. Bunchay.
Thank you. And Alvin and all the COIL member is very fantastic. We seem like we were independently, but we can at least in this webinar, we can know which each country are doing. We know that each country has their own problem and then facing, like Alvin said. And for the last 10 and 15-year history of AeHIN, we have a hard learning experience from, we think that standard could solve everyone. So we starting HL7, and then we found out that it doesn't work like that. Governance, architecture, and people are very important. And what we found that standard and interoperability usually these guys to be the technical problems by the policymakers or the people who have power and have resources. But the actual thing is the people and organization interoperability. What I learned very hard way the last decade is that organization, ministry, and individual, usually they fight or compete for power. They don't care much about the people. But we are, as a community, it seems like we have passion of the continuity of care. So with that, I think there is several questions in the chat. Alvin or our COIL member, anyone can pick one of those question and respond that suit you over.
Pabimo, maybe you can field one of the questions since you have a camera already on.
Yeah, I'm here.
Maybe you can talk about the question was on the cloud infrastructure. What is the choice of DTO Indonesia?
Yeah, actually, about the cloud, actually, we are using the multi-cloud solutions. I think there is a cloud there is already prepared for the fire, etc. So that's also one of the preferred one, and the other one who still need to deploy locally because by law it's needed that all the data stored in Indonesian soil. Like it's really needed to be the server is Indonesia, although it's a cloud solutions. So we only work with the provider that already have the server in on Indonesian soil. Is that quite explain the question?
Thank you, Pabimo. Maybe we can ask the other COIL members, if you can turn on your camera, then that means you're willing to answer a question. Dr. Chaminda, I asked you a question about how many fire servers, and then I think you responded with 5 virtual machines to support a Docker swarm, supporting a single instance. Dr. Chaminda, is that correct? And then Dr. Azrin, maybe you can follow. Go ahead, Dr. Chaminda.
Yeah, thank you, Dr. Alvin. So we have provisioned altogether 5 virtual machines. These are hosted in our data center of the Ministry of Health. We have a VMware virtualized, data center for the Ministry of Health. And I think the setup is there are 3 Happy Fire servers along with the OpenHIM platform, not the OpenHIM solution itself, but they have a solution called OpenHIM platform, which bundles, I think, GemPI, OpenHIM, mapping mediators, Happy Fire, etc. And the platform itself does the replication of the databases. And that sits behind a Nginx load balancer. So basically, we are using the 3, but I think there are, couple of bottlenecks when we started pushing data, started clearing a backlog. So I think we would need more resources to be allocated for the cluster. We are working on it. Thank you.
Thank you, Dr. Chaminda. Before we ask Dr. Azrin to share his experience, I'd like to ask everyone from the presenters to look at the Q&A and type an answer. Go ahead, Dr. Azrin.
Thank you, Dr. Elvin. Yeah. For Malaysia, we use MOH private cloud with their own data center. And currently, the entire ecosystem resides in 32 VM. Yeah, I hope that answered the question.
Thank you. Maybe while you're there, Dr. Azrin, the first question, how to create demand for the government or private sector to establish an interoperability lab? And then I'll call Dr. Prapat after.
Okay, it's like what you said. It's all about the people and the leadership. So what we have initially in Malaysia is we have a lab where we discuss on the use cases needed for the country. To address the issue of congestion, to address the issue of disease burden, and so on and so forth. And then from there, the paper was submitted to the top management of MOH, and that is escalated down to everyone to support and execute the digital health initiative, and that become a part of a digital health blueprint for MOH, as well as to be supported by the private sector.
Thank you, Dr. Azin. And the answers to the questions are coming into the Q&A. I requested Marian, our host, that we get a copy of the chat questions and the responses. So feel free to we have your email addresses already, so we can send this to you later on through Cherise. Uh, uh, this is all the time that we have. I'm sorry, but this is actually Global Digital Health Network, real estate. So I was able to get a few minutes, and I'd like to ask Dr. Prapat if he has any answer to any of these questions while you have the camera on. And that will be just before we wrap up and have our picture taken. Dr. Prapat.
Yeah, thank you, Alvin. I think I would like to say something about people thinking that to set up the interoperability lab have to link to MOH at the beginning. But the story in Thailand is quite different. I mean, we don't have any full-time people in the lab. It's all volunteer, and it start with like a research project. We apply for research project. We do the pilot, and then have to thank to Dr. Bunchai that every opportunity that he can get involved in MOH people, get involved in people in health. He start to educate the people about the international interoperability standard about fire. So it take about two years, I think, right, until people start to hear about HL fire, and it's coming later. So it's very slow start in Thailand. So I like to encourage our people that it doesn't have to start at MOH at the beginning. Yeah, that's all I would like to say. Thank you.
Thank you. Anyone else? Thank you, Dr. Prapat.
Okay, can I share some experience?
Sure.
So actually, in Taiwan, our government tell right now they don't supporting any. I think no any officially supporting to the SEDA and the interoperability lab. And actually, we provide a proposal to the government, hire their leader, and asking them says to tell them say we need some budget to hosting this kind of the lab to encourage the people using the international standard. But they deny the proposal. But right now they try to hosting a very different way. They put all international standard and the terminology into the one special office, and asking the more a group of people to adoption that in the next generation system. But actually sometimes they will not heard about the really needed from the medical service and also from the clinical system player. So sometimes they just doing what they want to do. So for the point of mind, this kind of the AeHIN community is very important because we can connect each other by ourselves, and we can share our experience and also our implementation experience, and then we can have a more detail about the gap. We can we can discuss about the gap from a different point of view. So I think not actually the government maybe in the future when they feel this is very important, they will try to supporting you. But right now, some governments still not doing that. I think that is the same situation with a lot of different countries. People adhere actually. Thank you.
Thank you. Gulbe, 30 seconds.
Yeah, I want to echo Billy's comment. The Hong Kong government also very support about our lab, but Hong Kong now the primary care is the focus. So we hope that our lab have get some funding from the government to explore the value of the lab interoperability to the primary care. Okay, that's my comment. Thank you.
Bimo, 20 seconds.
Yeah, I think
Enjoy.
what is really needed to help the government buy-in, because I'm actually part of the team that is connected to the MOH itself as part of the MOH. But I think the first one is the political will. It is very important about the leadership, about the people and the culture, because I still have a lot of questions how Indonesia could catch up on these interoperability matters. Is basically because we actually kind of have like more like a startup culture. So we are taking off with a plane while building the wings. Thank you.
Thank you. Yorn? Wise words. All right. Okay, so thank you everyone. I appreciate the recording. Thank you. That made us save a lot of time. Really appreciate it. And it's now on record, so we can keep on playing it. And I'm very proud of what we have achieved. I thank you all for all the persistence and perseverance. I thank you. And we will have webinars. We will restart the webinars, and then we will have a rotation. You will do it only once a year because now we have 10 interoperability labs. So that's not a lot of work for everyone. I look forward to having you again, and I pass the floor to Marion for the closing remarks while we have our picture taken by Cha. Marion, cameras on, please.
Thank you all so much for joining. And Cha, would you like to take the group picture or shall I?
Yes, I can take the group photo, Marlene. Thank you.
Okay,
Okay, everyone, please look at your camera. I count. All right. 1, 2, 3. I think it's dark here. Okay. I'll take another one. 1, 2, 3. All right. Thank you, everyone.
Thank you,
all.
everyone.
Thank you, everyone. Thank you, Musai. Bye bye.
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 See you when we see you.
See you later.
Thank you.